Well, let's continue with this story. Health Minister Dr. Zweli Mkhize temporarily suspending the rollout of the J&J vaccines as follows concerns, of course, from American health authorities about potential clots developed in patients who have been vaccinated. Of course, as yet, there is no link, and it has happened in just a handful out of millions of people who have been vaccinated. But for more perspective, I'm joined by Dr. Angelique Coetzee from the South African Medical Association. Doctor, good evening. You have had the Johnson & Johnson vaccine. How worried are you tonight?
Not worried at all. Good evening, and thank you for asking our opinion here tonight. So I think the reason why I'm not worried about myself regarding clotting of Johnson & Johnson vaccine is because we know that, yes, there is definitely a link between clotting and AstraZeneca, but
my understanding, sorry, Doctor, my understanding is that link has not been proven yet for AstraZeneca either. Do you have new information?
I spoke to some of the scientists, and according to them, there's clear evidence that there's, we know the clotting and between clotting and AstraZeneca use, but there's not so clear. That evidence is not yet here with the Johnson & Johnson. Now, one can argue that it is because maybe we haven't vaccinated enough people as yet. But up until roughly nearly 300,000 healthcare workers that has been vaccinated, and there was no adverse reactions regarding clotting been documented so far. Again, maybe we haven't vaccinated enough people to know about a possible side effect. But I also think it is prudent that the minister at this stage just put hopefully it's a temporary hold, just for maybe 24 to 48 hours so that we can get all the evidence and make sure that it's still a safe drug to continue. You need to understand that for South Africa currently, we only have Johnson & Johnson, Pfizer, and Moderna that has been proven that would be suitable for us, also with our variant that we currently have. If you take Johnson & Johnson totally away, we are stuck only with Pfizer. Moderna is not yet available in South Africa, and I don't even think they have applied to come to South Africa. Pfizer is going to bring its own difficulties regarding the logistic outroll of that. Pfizer itself, currently there is not a link, a causal link between clotting and the use of Pfizer. And as I've said, so far it's not been proven that Johnson & Johnson is responsible for clots. And again, in South Africa, not so much. So again, from a medical perspective, we know that you have a higher rate of getting clots if you're using birth control pills, or if you smoke, your risks are much more increased than by using Johnson & Johnson. I hope this makes sense.
Yeah, no, it does. And I think it's really interesting that the point that you're making. So you're saying you've spoken to scientists linked to the AstraZeneca trials, and they are telling you that there is a clear link between the AstraZeneca vaccine and these very rare cases of blood clotting. You make the point, of course, no clear link as yet with Johnson & Johnson. If there is, worst case scenario, if there is a link that is proven, two questions. First of all, will it take a few days only until we're sure? Do you think it's going to take a lot longer than that?
Well, there's only two ways that you can do it. You can look at the current scientific data, and the current scientific data available on adverse reactions that has been documented across the world of people using Johnson & Johnson. So that's one way to look at it. And the other way that you can look at it is if you wait long enough, about 4 years, 3 to 4 years, to have data, real-world data coming in and collect that. That's what normally will happen in any development of a drug. After you go into phase 3, you will then have 2 to 3 years, up to 5 years to test and see what is coming from, as I've said, real-world data or real-life data. We don't have the privilege of that. And again, I think someone made earlier tonight, Sally, I think it was maybe you, that made the comparison that if you look at how many people had clots out of how many people had already been vaccinated with Johnson & Johnson, then it's really a tiny bit. You will not get any vaccine or any drug out in the world there that will not give you a side effect. It's always there.
And I think that's a crucial point of perspective that you're making. I suppose then if there is a link eventually proven, what we want to know when we open that little leaflet that says these are the risk factors is be careful of using this if you are, for example, high blood pressure, if you're pregnant, if you have a history of what. It's understanding what triggers that potential clotting problem, isn't it? And that might take some time.
Yes, fully agree with you. And again, if you look at this, if you look at the numbers, it's really, I'm not saying, that having 6 people claiming that they had clots after they had Johnson & Johnson, whether it was related to Johnson & Johnson, the jury is still out on that. But 6 out of really millions of people is it really worth it to just stop everything now and say you're not going to use this vaccine? I don't think so. And again, Sally, as we have mentioned, there's no guarantees in life. There's no vaccine that will be 100% safe. You have to weigh up your chances. If you get the COVID or COVID-19 without being vaccinated, what would be your chances to survive versus your chances of maybe 1 in millions of getting a possible clot. And again, it's not been proven yet with Johnson & Johnson. My concern is that this whole hype about this might make vaccine hesitancy worse. There's already people who are, sitting on the fence, not sure whether they should take it or not. And this actually will fuel that type of thinking. And I think it's very sad because, as I've said, you've got a bigger chance of getting a clot by using birth control tablets or by smoking.
Yeah, that's a very good point you're making. What does this mean practically, this pause on the J&J rollout? Does this mean that a healthcare worker who tomorrow was due to get their vaccination will now not get that vaccination?
Yes. I think that's exactly what it means. As the Minister already pointed out, there is an urgent MAC on vaccines ministerial task team meeting tomorrow morning where this will be discussed. And, if we are sure that at this stage it is the side effects, possible side effects of clotting is not a real factor, then I think hopefully within 48 hours the process can continue, as we actually cannot afford at this stage to run behind. We are already behind, and we cannot afford to get more behind because we don't know what is waiting for us when winter is coming. And it's already showing that it's going to be sort of a cold winter in the mornings and at night, elevating your chances of getting flu. And you don't want flu and COVID-19 just because you're not sure whether this is going to give you a clot or not.
Bearing in mind there's no link proven, even if there is a link, it's extremely, extremely rare. Do you think that the South African government, while being, they're trying to be as cautious and transparent as possible, but do you think perhaps they're being overcautious and they should just go for it?
Well, the poor minister is damned if you do and he's damned if you don't. So I think he's trying his utmost best not to be accused that they were strict against AstraZeneca. Now why don't they apply the same rules to Johnson & Johnson? And I think again, on a political way, if you look at the pressure in America currently, it might spill over to us here. And I think it's a good precaution that he's taking for about 24 to 48 hours. And I think let's see what we come up with the data available to us, and hopefully we can continue with the program.
Absolutely. Well, thank you so much for chatting to us this evening. That, of course, is Dr. Angelique Coetzee. She's from the South African Medical Association.